Hello, I'm Dr. Len Saputo. I'm here with Dr. Mayor Schneider. Dr. Schneider is a licensed massage therapist, has an honorary degree, a PhD in the healing arts. He's the founder of the Self-Healing Research Center and also the School for Self-Healing in San Francisco. He's the author of several books, among which are Movement for Self-Healing and now his new book, Vision for Life. He's an international lecturer and instructor. And today we're going to talk a bit about vision because that's one of the things he's really an expert in. And one of the things that Mayer is really well known for is that he can help people to change their vision from aging eyes, from macular degeneration, from eye trauma, from almost any glaucoma, any condition you can think of, doing it natural. He's kind of a holistic thinker. And so we tend to rely, Mayer, in medicine on technologies. We tend to move to glasses real quick, or surgeries, or drugs. We tend to fix things like cataracts and aging eyes and glaucoma. And you do it differently.
You know, what's interesting is that I was born with cataracts. It's not very usual to be born with cataracts. My two kids were born with cataracts as well.
Wow.
I think that my son is suffering from the fact that he got a lot of injections when he was an infant to remove his lenses.
Wow.
But his vision is terrific.
Really?
Yeah, and so is my daughter's. It's considered to be the best vision in the world of kids who were born with cataracts.
Wow.
And that's one of the reasons that their doctor, Dr. Hoyt, really appreciates the work I'm doing, because he saw the work that I was doing with my kids. Normally, they see 40% of normal vision, 2100, with a lot of corrections. And doctors are so happy with this because they used to almost be completely blind.
Right.
But my daughter sees only 2020. My son sees 2015 with correction.
Whoa.
Which is really unbelievable. And without correction, my daughter sees 2050 and my son sees 2040. And that's people with no lens. Okay. So I was born with cataracts. And I have 99% of my lens is scar tissue.
Jeez.
And most of the light should not go through. And I learned to work on my eyes and to get to a place where today I read, write, and drive.
I know you have a California driver's license with about 0.5% of one retina.
From 1% vision to 70% vision.
And how did all that happen?
With eye exercises. Eye exercises and new visual habits. It's interesting that when I was a kid, I used to read Braille, and my teacher, when I would try to look at the Braille, my teacher would say, "Look away, you can't see anything anyway."
Jeez.
And when I started to work on my eyes, I learned to look at details. And this is something that is interesting from my perspective. As I started to look at details, I saw them in a gratuitous way. I would see a furniture and people, put them in one category, see them as one thing. Slowly, I learned to look and distinguish between details. In fact, in my book, Movement for Self-Healing, I've written about how I spent a whole summer looking at windows and air conditioners.
Wow, why is that?
Because the windows were square, the air conditioner was square to the side of them. Learning to look from detail to detail. It's interesting, my son had his lens removed at the age of 2 weeks of life, the age of infancy. And he was looking at black and white checkered squares when he was 8 weeks of age.
Jeez.
And
so you knew all this in advance.
Yeah, and it's a very interesting thing. And so what happened is, at the age of 17, I became 2 weeks again in terms of my brain development with vision. And so I learned to work with my brain and to compensate for the huge anatomical loss that I have. And it's a very interesting thing. I am working still at the age of 58 away from using other senses instead of my vision.
You also are strengthening your eye in a way that's different, because when you're using the eye exercises you're taking what might be an average or a weak situation from the point of view of your muscles or your rods and cones or whatever, and stimulating them so that they work better than if you hadn't done those exercises. It's sort of like you use it or you lose it, and if you use it, you can strengthen it. Is that right?
Very interesting. Absolutely. Very interesting. You know, there was a research done by neurologists, and they found that people who got strokes and had visual loss, that if they would stimulate with light the areas that were lost, that a third of them would gain significant vision back, a third would get some vision back, a third would not respond. I have better statistics than that, but at least they started to go in the right direction. Now we're talking about neurologists.
Yeah.
They went to ophthalmologists. The ophthalmologists did not listen to them. They went to occupational therapists who also did not listen to them. And they were very, very frustrated over that particular issue. And I want to tell you that actually you can stimulate areas which consider to be almost blind spots in people who lost a lot of vision, and quite often gain vision back as a result of that.
Well, I think I know why. Because, see, there's an area where the tissue's dead in the brain from the stroke. The area around it is called the peri-infarction area, which means that the tissue's not dead. It still has some circulation, but not enough to make the tissue function. And if you start using that area of the brain more, the circulation follows.
Absolutely.
And the next thing you know is you can see. It's like magic.
Absolutely.
I've done this with people with infrared light, which is for another story. But that's
wonderful,
interesting.
wonderful, wonderful, wonderful. And what I want to say about that is also you could have one neuron that is not working, another neuron is not working, but the one in between could be working, and it needs to communicate to another neuron.
There you go.
And if you start to stimulate, they'll start to connect, and the function will come back. That's so important. And function, to a great extent, affects structure. So the work on the eyes is important. So now when we return to the person with normal vision, because you don't know, it's interesting, when I work on my yoga for your eyes, I did work for people who have natural vision, regular vision, and they want to see better. When I work on the kit for natural vision improvement, I work with people who use the computer and work on them seeing the computer without eye strain. For example, looking at a distance. When I work on Vision for Life, I started to call this book From Blindness to Sight, to just create good stimulation. But I decided Vision for Life because it works with quite a few people that are not blind. It works with people with normal vision, with nearsightedness, farsightedness, etc. And what I was teaching is that there are 10 steps in each situation that a person can take to get better, to relax the eyes, to adjust to different light frequencies, to look at details instead of not looking at details, to pay attention to the periphery, to create more movement, to create better connection between the body and the eyes, to make sure that the eyes are working together and their strong eye does not overpower the weaker eye. All those are so important, because you know, when a strong eye overpowers the weaker eye, the brain takes neurons from the weaker eye and uses it for the strong eye. And that weakens up the weaker eye further and overburdens the strong eye, and it's not a good thing for the system. We need to create balance. And you know, Dr. Saputo, when you studied medicine, the first thing you studied is the law of homeostasis, how important it is that we have homeostasis. Looks like in practice, most doctors forgot all about it. And they only work with symptoms when it comes into the eye. So in the vision improvement work, we definitely try to enroll all nature's power. People poo-poo nature's power these days. They try to overpower nature. What gives you waves in the ocean? What gives you wind? What gives you tornadoes? Nature. What is more powerful than your old blood flow? And if you had good blood flow, you probably will not have vision problems, because most of the blinding condition in the Western world come with poor blood flow to the eyes.
You know, in closing this section, Mayor, I just want to say that what you do is what I do. We think the same way. And I think that looking at lifestyle, how we live our lives, how we exercise, how we eat, how we reduce our stress and sleep, how we relax, and how we will pay attention to the whole nature of who we are is what healing is about. You know, Albert Schweitzer said it pretty nicely. He says, my job as a doctor is to introduce the patient to their own inner healer. And that's basically what you're doing. So I like this idea of natural vision improvement, because it's not risky. It's not oriented to things that are related to business. Because the business of medicine seems to be running the practice of medicine. And in your field, you're a leader, and that's why I think some of the forward thinking on people who are ophthalmologists approve of your work. So thank you so much for being here and sharing that message.
Thank you very much. And again, I agree with you. And by now, people don't know how to not think about symptoms. It's time to think about our power.